Good evening and welcome to another edition of Borno Health Update. I'm your host, Ibrahim Amarawa, here to shed light on the remarkable stride being made in our healthcare sector under Governor Zulum's visionary leadership. Today, we focus on the transformative efforts spearheaded by Professor Baba Malam Gana, Commissioner of Health and Human Services, who is driving innovations and resilience in our healthcare system. The Borno State government has made significant stride in revitalizing its healthcare sector, establishing it as a benchmark for excellence across Nigeria. Through strategic investment in infrastructure, medical personnel, and essential services, the state has not only improved healthcare delivery, but also set a standard for other states to emulate. These efforts have earned recognition from the federal government, which has pledged continuous support for further strengthening Borno's healthcare system and mitigate the challenges posed by the Boko Haram insurgency. Recently, the House of Representatives Committee on Health visited Maiduguri on an oversight function. The committee's engagement underscores the federal government's commitment to sustaining and scaling these achievements, ensuring that Borno's healthcare system remains resilient and responsive to future demands. Briefing the committee on the giant stride made by Governor Zulum's administration in the area of infrastructure and human resources, the Health Commissioner, Professor Baba Malam Gana, said the Borno State government has excelled in reforming the healthcare system to meet the test of time.
Appreciation of what our leader, compassionate leader, Professor Babagana Umara Zulum, has been doing in Borno State in healthcare and also other sites, including education. Going directly to some of the points raised, I would like to share with you, sir, that the staff in Borno State Health workforce who are based outside Maiduguri get what is called rural posting allowance. And that is 30% of their salary.
Added to their salary?
Yes. So 1/3 of their salary is given to them as a bonus because they are posted outside Maiduguri. And that's one way of encouraging them to go to faraway areas. In Hawal, in Bayo, and Shani, they have been enjoying this. I was in Monguno recently. I asked them, they say, no, we've been enjoying it from day one. That is number one. We also have a law now in Borno State that, if you're fit and healthy, you don't retire at the age of 60. You carry on. You need to request that I have had enough, or health ground that you want to stop. Then only then you'll be giving your gratuity and pensions. But otherwise you carry on until you're 65. So it's now a law in Borno State. So that's one way we're trying to, keep well-experienced people, who have been serving the state for many years and want to keep them. And most importantly, last year in November, we hosted the whole country at the National Council on Health. At that meeting, His Excellency, pronounced that the salary structure of Borno State is going to be the same with the federal. And that is now being implemented. It's being implemented. And furthermore, the area of human resources for health is a problem globally speaking. For example, even UK needs 10,000 human resources for health every year. With the Ukraine war and Brexit, they all moved back to the mainland Europe, and therefore the gap is filled by Nigerians. Every hospital you go to in the UK, you see about 100 Nigerians in one hospital. And according to the Registrar of the Medical and Dental, in 2024, 4,193 Nigerians, doctors, asked for certificate of good standing so they can japa. So we have to do a lot to be able to retain, our people. We are also hit by Saudi Arabia and UAE, especially here in Borno State. They come directly, recruit our nurses, and go with them. So in order to have enough, that is why His Excellency built a school of nursing midwifery in Monguno, which is rural. Also in Goza, which is rural, it's in the southern part. Goza is in the southern part. And then increase the productivity in the College of Nursing here in Maiduguri. All this is done to increase manpower. And you will see later on today, the medical college is ready. It will go around later on, you'll see it, and that will attract quite a number of people. Furthermore, we have sent nurses for postgraduate training, such as to become tutors. They are called tutors, they are lecturers, for the colleges of nursing. We have sent 20 to Bayero University for training, masters. We have sent 20 for ophthalmic nursing, because we've got now 3 eye hospitals. We've sent 20 for orthopedics training. So we've been trying to gradually do that. And the specialist doctors, we have 55 in our books now, who are doing postgraduate training all around Nigeria. And His Excellency is paying their full salary. And also every year, he gives them 1 million naira. They encourage them if they need laptops, etc., to facilitate. So these are all done to encourage our own local people to actually, already some of the postgraduate doctors have started coming back. Like in State Specialist Hospital, 3 consultant hematologists have come back. And we expect them to be part of the teaching hospital very soon. So these are some of the areas, and to be able to keep the human resources, we have to produce more, so that even if some go away, we still have some who can be able to do the job for our people.
Professor Baba Malamgana also informed the August visitors about the multifaceted approach taken by the Zulum-led government to curb the maternal mortality rate in the state.
In terms of the maternal mortality, sir, I want to say that we started the issue of maternal mortality even before federal government. We invited the minister to come, he couldn't make it, so Moi Aina, the ED, National Primary, came. And he read the minister's speech, verbatim. We were concerned. At that time, anecdotally, we didn't have the data. But then later on, data showed we were right, that Northeast as a zone is the second highest after Northwest. So it's something that some of us feel ashamed that Nigeria, with the enormous wealth, cannot look after its citizens very well. Maternal mortality is an important indicator. Newborn mortality, very important. We're second to, India. Maternal mortality, we're the worst. The worst country to have a baby is Nigeria, officially now. If you take HIV, Nigeria is second after South Africa. If you take malaria, 4,000 children die every week from malaria in Nigeria. We're the worst in the world. So all these indices, if you as members of the House of Rep can sit and deliberate on this and push the government so that we can change this trajectory. For maternal mortality in Borno State, we have introduced safer bundle of birth care. We're the only one to do so after my visit to Tanzania, where they actually reduced maternal mortality by 75%. It's really not a mean task. 75%, and they reduced neonatal death by 45%, and fresh stillbirth by 25%. So we took that idea, brought him to Maiduguri, we're piloting in 4 institutions, and we are planning to escalate it to all the 13, we call them MAMI, because they are the highest burden maternal mortality areas, so that we can be able to see results. And furthermore, we are fully engaged with the federal government in terms of the MAMI program. This is being plugged off, ideally maybe tomorrow, but due to some reasons, not tomorrow. So that is also on the map. And we're also into what is called E-Motive. E-Motive, or postpartum hemorrhage program, is where you use 3 drugs, misoprostol, heat-stable oxytocin, which is called carbazotocin, and also tranexamic acid. If you give it to a woman who is bleeding profusely after delivery, then you can reduce maternal mortality. In Kenya, where it was tried, in India, they have in Kenya, in Mwanga area in Kenya, they call it, shawaga, which means dry. If you give it to a woman, it dries up the bleeding. So we are also introducing that in Borno State. So we have multifaceted approach in curbing maternal mortality in Borno State, and therefore, hopefully, next year this time, we'll probably telling you different figures.
That was the Commissioner of Health, Professor Babamalam, briefing the committee on the developments in tackling maternal mortality in Borno State. Earlier, the Executive Secretary of the Borno State Contributory Healthcare Management Agency, Dr. Abba Saleh Kaba, and the representatives of the Executive Secretary, Borno State Primary Healthcare Development Board, enumerated the challenges they faced in accessing federal intervention funds provided for the people of Borno to benefit.
You can see in 2025, 280 allocated yet to be released, and then another one allocated for quarter 2 yet to be released. A patchwork of coverage and access. According to the National Health Insurance Authority 2024, about 198 million Nigerians are enrolled into basic health care, supported health insurance barely scratching the surface in the nation of over 200 million, of over 35,000 PhDs nationwide. Only 7,250 have received funds, funding support. As highlighted by my other counterpart, even in Borno State, we are also facing similar. Out of 312, we were only managing about 112 of them. So almost more than 50%. So this is actually the percentage of population covered with health insurance by state as of quarter 4, 2024. You can see that rate margin is actually around 9%. So you can see the across board, with the exception of Delta State and FCT, and also Lagos to a certain extent, that were above 9%, but all other states are below 9% tile of coverage, which is actually far, far, far beyond reaching universal health coverage, unless if we got up to 60 to 70% of people being covered by either basic health care or otherwise by vulnerable group scheme, because we have high level of vulnerability in Nigeria, ranging about 68 to 70%. In Borno State, we have up to about 76% vulnerability. So until when these vulnerable groups are given prepayment, are being placed under prepayment mechanism, we cannot achieve universal health coverage through out-of-pocket funding. These are basic health care provision fund releases at the state level. So you can see the release in 2021, the Borno State Contributory Health Care received this amount of releases, accruing up to 2024 of about 2.6 billion. While at the primary health care level, we receive about 686 million naira. The total of about 3.4 billion was actually released over the 5 years. So this is one of the counterpart funding that was actually released to the agency for the basic health care provision fund. That is only actually for the gateway of the Borno State Contributory Health Care Management Agency. For the primary health care, also have almost a similar amount of money that has been released to them. The total is around 200 million naira that was released by Borno State government, by His Excellency, to actually improve the coverage. This is what also the Honorable Commissioner has highlighted. We were able to cover about 94,000 individuals, and across the aged, 14% goes to the aged, then the poor also get the 14%. People living with disability, and then the pregnant women, the under 5 children. We have actually a large pool of sickle cell disease patients too. We are also we were able to also give them some coverage. So you can see, totally, if you see, we are giving more priority to children under the age of 5 and pregnant women, so that we can reduce the maternal mortality and under 5 mortality burden at the state level.
And Borno State was able to join the national primary health care to develop a zero plan, which we developed, and then we align with the other states to identify our workable strategies, including IEVs and other strategies across the high volume zero dose LGS. So looking at how we come about the zero dose, when Gavi identified 100 to prioritize zero dose across the entire country, Borno State is contributing to 8% of that zero dose burden. And then we have to look at inward, what are the main key things that has contributed to us having high burden of zero dose, which include insurgency and lack of clear access to the health care, especially the routine immunization services.
The chairman of the House Committee on Health, Dr. Amos Gomna Magaji, praised Governor Zulum's unwavering dedication to improving health care, adding that from what they have seen on ground, Borno State will soon become the medical tourism center in the country. And he also promised to look into the issues of non-release of intervention funds from the federal government.
Let me start with the son of the soil, Dr. Medalla Balai. And I'm happy that you're here, because your local government too have been one of those affected. And I'm also happy that you're here. You have also seen the development that His Excellency Professor Gov Zulum has brought to your 2 local governments, Askira Uba and Hao. All of them have received the attention of the state government. And let me, before I forget, I want to sincerely thank His Excellency for all the projects that he is doing for his people. Honestly, the story of Borno State is the story. Borno State is not only in the news for insecurity, but Borno State is also in the news for proactive, sensible, and developmental leadership. We have seen, if what has happened to Borno had happened to many states, I don't think by now they would have come out. Yeah. But you are where you are today because you are deliberate, you are passionate on development. And I don't see, I wanted to appreciate the Commissioner of Health. He came yesterday to see us. And then I wanted to say thank you for coming, but what else do I expect from him? I don't expect less, because the governor has shown the direction. Even just now he said, you will just hear that the governor has gone to that side. So he doesn't give room for any of his commissioners or any of his lieutenants to show lackadaisical attitude. We are all where we are for such a time as this. In some few years to come, if a meeting like this is called, none of us will be on this seat. because we'll probably have retired or we'll probably have died or a new team would have come. So now that we're here, let's do our best and make sure that we move our country and our state forward. This is the first visit we have begun, and I'm challenged to not only go through the zero dose, high zero dose state, but I'm telling you this oversight will go through all the states of Nigeria, so that we need to track the funds, we need to make sure that they are released timely, we need to also be sure that what they are released, they are being adequately and judiciously utilized. So you are doing so much to position this state as a global hub for medicine. And I can say very soon, Borno State is going to be home for medical tourism. Yeah, I see it happening. Let me also announce to you that the bill to increase it from 1%, the basic health provision, from 1% to 2% has gone through the second reading. Yeah. So we're trying to make sure that we move it from 1% to 2%. So if it goes through that, what will happen is that some of those funding, that's why we need some of these information from the state. With that, we'll keep it as our points for arguing really the need for the increment for the state, and of course the increment for the amount.
The committee members were later taken on a tour of the multi-billion-naira medical college and Kashim Ibrahim University Teaching Hospital, which is at 95% completion, as well as Yerwa and 1,000 housing instead primary healthcare centers. The committee members were also paid a homage to the Sheikh of Borno as a mark of respect and appreciation for the traditional institution support of the healthcare programs. In an interview, the chairman of the House Committee on Health, Honorable Amos Magaji, praised Governor Zulum for reviving and repositioning the healthcare system, which was hitherto ravaged by the insurgency.
We came here because of the state, which Borno State is one of those states in the north that has high zero dose, and that was one of the first reasons why we came here to see firsthand what is being done, what should be done to ensure that we reduce the zero dose in the state. And that's why we had an engagement with the Commissioner of Health and then primary health care and many of his directors. Of course, we left there and we visited many facilities, primary health care within, and right now we're in the Borno State Teaching Hospital. Our impression with what we have seen on ground and the adequate steps that have been taken to meet up the universal basic health coverage. We are sure that by the time we're here next year or after, certainly with the step that the state government is taking currently, the result we had before, we are sure we will not have it again. Because with what we have seen, the dedication of the workers, and then the programs that the state government has put in place to address some of these issues. This is not to be seen as if I'm trying to be just praising the governor, but honestly, the governor of Borno State has earned respect among governors in Nigeria. This is a state that I believe, if it were another state that has faced what Borno State has faced, I don't think they would have reached where they are today. I can see vision, I can see commitment, I can see deliberate effort to develop and to transform the state. And we can say congratulations, His Excellency Governor Baba Gana Zulum, for what you are doing to the state. And then what we have seen so far and what we have heard, we just pray that by the time the governor leaves, the person coming after him will be able to do even more.
Thank you for joining us. Stay tuned for next week's episode, where we'll explore more innovations in the healthcare sector. This is Ibrahim Amarawa reminding you health is wealth and Borno is rise.